Zambia is the first country in sub-Saharan Africa to offer an injectable HIV prevention drug outside of a study setting. For more insight, I spoke with Lackeby Kawanga, Director of Technical Services for the global healthcare nonprofit JSI for the USAID DISCOVER project in Zambia.
Cabele, like you've said, is a long-acting drug, and it is cabotegravir, and it's given as injectable. For prevention, we're giving it every 2 months. So Zambia was one of those countries which were privileged to also be supported by PEPFAR with a few doses so that we can roll it out in our country. And excitingly, we were the second country outside the research settings that were brave enough to just start this. And thanks to the Ministry of Health, with stakeholders and everyone that came on board so that this could be done. Oral PrEP has been fantastic. Since 2018, I think up to now, the Ministry was talking about 600,000 people have accessed oral PrEP before in the country. So meaning it was well received and a fantastic formula that we've been using. Then on top of that came Cabele. The major thing that I can say was we needed option. And the major thing again to look at when you're looking at Cabele and oral PrEP, Cabele came more or less to look at what could have been the barriers with oral PrEP that it could work on. So that's how it came, and it's injectable, you receive it once, while oral PrEP you take every day. But Cabele comes with this aspect where it can work on that stigma aspect. If you want to keep it to yourself, you can keep it to yourself. You receive an injection and you're quiet. All that you do, you go back to receive another injection after 2 months.
So it sounds like it's a very good option. I mean, when you talk about alternative, I'm sure a lot of people will want one injection every 2 months instead of a pill every day. Tell us more about some of the challenges, actually, because rolling out something new is not easy.
I'll get from what the ministry said is when it comes to testing, for HIV testing, what we realized was with Cabele, you don't only need the rapid tests that talk about only identification of antibodies, or what we call the serological testing. It requires also somebody to do a nucleic acid testing, which goes for the DNA. So that comes with another cost. And Cabele, as of now, since it's still new, requires that we do a number of tests to make sure that our clients are safe. You know, safety comes first before anything. So because of that, it also comes with an additional cost. We need to work on our network and just increase the capacity of our PCR testing almost everywhere, because we just have a few points where we do that in a district or in a province.
How has the introduction of Cabele changed the landscape of HIV prevention in Zambia and reach populations that were hesitant, for example?
When Cabele was introduced, for us as JSI, I think we supported about 4 sites with 2 outreach sites in about 2 districts. So as of now, we haven't very much gone extensively, but quite a number of people have received it. Under the facilities that we support, we have about 1,218, which is a good number in the few 6-7 months that we've done. So what I've seen as a change in the landscape, in the facilities of the catchment populations that we support, there's been that excitement of a new formula. Because that 1,218 during this period is about more or less, is it 50% or 60% of the people accessing PrEP? So meaning the population or the communities itself is excited and acceptance is high, because the way they're receiving Cabele is competitive to oral PrEP. One other thing which we've come to discover is with oral PrEP, it requires you to come back, what we say continuity in use of a certain formula. So last time when we were doing oral PrEP only, when you do an analysis of continuity in use, when it was oral PrEP only, it used to be at 1 month, a little bit like, what I can say, more or less like at 65%. But after introduction of Cabele, we've seen everything has gone up. Continuing use now is standing at 86% when it comes to at 1 month assessment, which is very good. And when you tease out Kabele on its own, continuing use of the formula at 1 month is going as high as 97%, which is excellent. So meaning people who are still at risk, remember it's PrEP, you can fall off when you're not at risk. So meaning people who are still at risk are able to come back and get their second dose. They're able to come back and get their third dose. And not only that, I was just talking of 1 month. When you go to 3 months, because after 1 month, they'll come after 3 months now, after 2 months, which makes it 3 months, we did an assessment. It was about 89%, which is very good compared to the time we're just using oral PrEP.